I guess we can get started. Dan, is that you on the phone?
Yep, I'm here.
Okay, great. We'll call the meeting to order. Have we been properly noticed?
Yes, you have.
Okay. Public comment, correspondence, communications, anything?
None.
Okay. Okay, great. Call for the approval of the minutes from our last meeting.
So moved.
Second.
Okay, all in favor?
Aye.
All right.
Excellent. Yes,
Tell me, who makes the motion? Could you say who you are when you make the motion, please?
Alice Reed.
And the second? Who made the second?
Lou Hero.
Lou Hero. Okay. We'll start with Amanda then.
Can you hear me okay?
Yes.
Okay. On what's going on Lasata campus. So on Saturday afternoon, we were notified that we had another employee test positive. Had been in the building within the time that she was experiencing symptoms. So technically we're considered, according to public health, as an outbreak because it only takes one person. So what we decided to do was initiate all campus testing to include our residents, our tenants, and all employees on campus. So on Saturday evening, we started testing all the residents in the care center. By Sunday morning, we were done with testing all the residents at the care center. And we started Sunday afternoon testing all employees through our drive-through and our back lot, which is actually still going on right now. We have, since the beginning of the pandemic, we've had 4 total employees test positive. So this would be our 4th. I'm thankful to say that since the beginning of the pandemic, no residents or tenants have tested positive. We're going to be finishing tenant testing at the Heights and the Crossings today, in addition to all employee testing. So today is the last day through 4:30 p.m. for folks to drive through or walk up and get tested. And we're hoping to have those results back maybe by the end of this week, but likely early next week or over the weekend. This morning, we received notification that out of the residents that were tested that the lab did receive, all 82 were negative. So that's fabulous news. We don't have any employee tests back yet, but we're hoping to get some results tomorrow morning for those of us who are tested on Sunday. Let's see what else. We did hear, we've had been on calls from the state for the DQA specific to guidance released in the near future specific to beauty salons and beautician services. That is the #1 complaint actually over visitation is that people want to get their hair done. And they're trying to put their heads together to come up with some type of guidance specific to bringing the beautician to a facility versus folks going out into the community. Obviously, we have the opportunity to control those factors and the risks better if we bring something to the building versus folks taking people out to the community. So we're hoping to have some guidance on that. And then also, of course, visitation. We're hearing all over the country now that facilities of all levels, so assisted living, some nursing homes even, have opened up their doors and allowed visitation with socially engineered practices. So 6 feet apart, masking, hand hygiene, things like that. But it's not going as well as people had hoped, because when you put a loved one in the same room as their, as their family, and after not having seen them for 3 months, it's very difficult to control the situation. And people are just basically beelining for each other. And so in order to control that situation, we have to be very careful about what's happening. So we're not doing anything in the state of Wisconsin, from my understanding, specific to nursing homes or RCACs or CVRFs, because we have not received any guidance from the DQA about that yet. So the independent apartments, however, we've moved forward with allowing them to go into the community. We have not started any type of communal dining at the Heights or any activity program to prevent or minimize the amount of risk that if someone did test positive or come down with symptoms, that we would spread it amongst those individuals. That's pretty much I have for the COVID update, unless anybody has something for me.
Okay, so at this point, they're still not able to visit in person.
Correct. So in person, we are still doing window visits or door visits. So the families come to the windows on their own, or we schedule visits at the door between the glass. For people who potentially are like on the second floor, we bring them down to the first floor, and the family members then outside the door or a window with it remaining closed at this time.
Okay.
When do you think, I'm sorry, this is Dan Becker. When do you think we'll be able to do those in-person visits again? Or is it still like, who knows? Nobody knows.
Well, yes and no. So yes, nobody knows, but we're anticipating that the state of Wisconsin, the DQA, who regulates us specifically, the Division of Quality Assurance, is going to release some guidance specific to some parameters related to in-person visitation. It's likely going to be the same thing that we're all trying to practice, is remaining 6 feet apart, wearing a mask, practicing hand hygiene, and then socially engineering furniture, so to speak, so that we can control the situation as much as possible and not allow physical contact or any type of transmission in the air.
Well, yeah, thanks. That all makes perfect sense. And thanks again for all you guys are doing. I mean, this is incredibly challenging times for you, and you're doing a wonderful job.
Thank you. The community and the residents, tenants have been very supportive, so we're thankful to have that.
Kirsten, do you have anything to add to what?
I think Alice is trying to.
Oh, I'm sorry.
Oh, I'm sorry.
Myself. Yeah, and a ditto on those congratulations. I'm sure this has just been really fatiguing and exhausting and really tough emotionally. And congratulations on 82 negative residents.
Yeah.
You know, I'm sure that, you know, it's luck of the draw sometimes too, but it's great that we have that record right now.
Mm-hmm.
And I really do feel for those residents, you know, not being able to embrace their family members is really tough. So I look forward to seeing what guidelines the state comes forward with.
We are.
Are we expecting the state to come forward with anything? Kirsten, do you have any knowledge of that? Or is she not really here? Just her name is
I'm
popped
here.
up. Oh, okay. Go ahead.
I don't know what DQA is coming out with. With all things related to the state, their guidance has been intermittent, but I like Amanda said, we anticipate that something's going to come out. I just want to say that LASADA has done an excellent job of trying to mitigate risk, and they've worked really closely with us in implementing everything they can to keep the residents safe. So we appreciate the partnership.
Yeah, great job. I think even, you know, whenever I talk to people in the community, everyone is so amazed that LASADA has not had any residents get ill. And I think that really speaks to what you and your staff are doing. So thank you.
I have an amazing team. I mean, the nice thing about LASADA is the relationships and the longevity that we have. Most of the staff have been here for a long time, and we trust each other. We take it seriously. We treat each other like we're family. So we treat the person who's in front of us like their own, you know, family, our own mother, our own grandmother, whatever the case may be. So they're willing to do whatever it takes to keep people safe. So we want nothing more than to be able to reunite people safely at this point. Because again, I know how emotional it's been on the residents and tenants and families, and we're hoping for something so that you know, it's just something so that we can get some interactions going in person.
Mm-hmm. And I think the key there is safely,
Right?
You know, which is what we're all concerned about. Okay, other than any other questions on LASADA? If not, we've got some changes that have happened at our other buildings there, right?
Right. So Kristen Sonnenberg, excuse me, has moved over to the director position at LASADA Heights. Beth Karstens has retired as of June 6th. And we've hired Patricia Fabian as the new director at Lasada Crossings, and she's been here 1 week, and Monday and Tuesday. So she's been, I was gonna say, brought into our family with a bang, so to speak, and she's doing a great job, and we're lucky to have her. So that's what's going on campus primarily. Let's see, we did have our infection control survey at the care center on June 10th. Where the surveyor comes into your building and analyzes and looks at how the staff are practicing infection control protocols, and we passed with flying colors. They also interview the staff to ensure that they know how to doff and don, or don and doff PPE. In addition to that, they ask the staff if they have the tools or the supplies that they need to do their job safely, and there were no concerns there. They did a great job, and they walked out in 45 minutes with
Wow.
no deficiencies. So this is our second deficiency-free survey in a row. So we're happy to have that. And of course, we're 5-star quality rated by CMS right now. So we're doing well. It's a lot of work, and like I said, I have an amazing team, and we're tired. We're COVID fatigued, let's say, and ready to move on, but we're doing whatever we need to do.
Well, great job. I mean, that's incredible, you know, in the midst of all the extra pressure of COVID, to pass that is wonderful. So great job.
Thank you.
Okay, anything else for Amanda?
We just have a financial update, and one of the things
Sure.
I think that the committee needs to consider in the near future is what we're going to do with the Heights apartments. At this time, some of those, we have a few apartments. Chris, how many? 4, I think, that we were undergoing renovations.
We have 2 that are currently undergoing and 4 that are ready to
Oh.
they're empty and we're ready to start moving on them.
But I understand, obviously, with, you know, with trying to control expenses and things like that, what we want to do with moving forward. Do we finish what we've done? Do we start the other 2? Do we hold off? So we'll need some direction sooner than later, I think.
Yeah, well, I
How
would
many
say,
vacancies? How many vacancies, Amanda, do you have?
I think we have 10 empty apartments right now, and
Wow.
yeah, it's a huge amount. And most people obviously do not want to commit to coming into independent senior living if they're not able to see the apartment. And with the amount of people that are not moving in, because of the fact that there's so many restrictions going on in senior living right now, people just aren't making those moves. They're rather just staying home, or they're moving in with family. So we need to be able to get those apartments done, at least the 2 that we have, so that we can get them occupied. And we need to start bringing tours in, but we're not going to do anything until it's complete. So
absolutely, we need to finish the 2 that are in progress. It would sure be nice if we could keep moving forward, since we have all of those empty apartments.
Right.
Because we want to get it done as quickly as we can. Now, we were using the money that was coming in from the Heights,
right.
right? So we
Right. So
still have some money there, right?
yeah, if we started on the 4 that, if I could get quotes on the 4 that are open and ready to start remodeling or refreshing, that would probably be reserve money, but I think, you know, there's enough reserve that we could get those knocked out. And, you know, I'd have to talk to the vendors and see how they feel about it. Right now they've worked on 2 at a time, how they feel about 4 at a time. It'll go much faster for them that way.
Right. I think that's something we should have on our agenda for our next meeting. If you can do some research on that, keep going with the 2 that we've already started, and then let's look at what we could do to get that moving forward, because that would be great.
I'll have them start coming in for quotes.
Okay, sounds good.
Hey, Kathleen, could I ask a question?
Absolutely.
These apartments that are currently vacant, what is it costing us per unit to remodel them?
They're all 4 of them are 1 bedrooms. So we're keeping it under 20,000.
Under
Some have a
20,000?
little,
Yeah.
yeah. Some have a little more work than others, but between 18 and 20.
Yeah.
Are we using a contractor, or are we using our own people?
We are using community vendors.
Right. We set
Contract,
this
yeah.
up, this was something we started last 2 years ago. And we
Well, I
made,
would ask that if it isn't proper to talk about it now, put it on the next agenda. And that we should consider doing this while we have the vacancies, and we'll have to
Right.
find the money somewhere.
well, like I
Because
said, we do have
it'll
some
pay
money
for
we need
itself.
to.
It'll pay for itself rather quickly,
For
rather
sure.
than have them sit 4 or 5 months vacant.
Right.
Right. Yeah, so I think we can make some decisions hopefully at our next meeting. Chris can get some more information on how we can proceed. If we could proceed faster, that'd be great. We started doing them as they opened up, but if we have 10 that are open,
Right.
it would really be nice to get those done.
Well, you might be able to save some money on this too, because now the people are working with a vacant apartment, they can move from one to another to another. So
Mhm.
maybe that's something you could talk about. If you need any help, let us know.
Will do. Thank you.
Okay, anything else for Amanda or Chris? Chris, did you have anything else?
No, I think we're holding our own financially. We did get those 3 COVID relief payments. I have applied for, the state has opened up now, their CARES funding. So I've applied for the crossings and the care center funding through the state. And the feds have actually opened up now their CARES funding to our CACs. So I've applied for that. That's what I did this week. I applied for the 3. I have no idea what we'll get, if we'll get anything, but I gave them the information they were requesting as far as, prior revenues, current revenues, revenue losses and expenses due to COVID. So I'm fairly certain we'll get some extra funding there.
All right, thank you. Chris, you've done a great job of staying on top of this and making sure we're getting what we need.
Thank you.
Okay, there's nothing else. Thank you, ladies. Keep up the good work and hope we can see you sometime soon in person.
Sounds good. Thank you.
All right, moving along. I don't think we have anything from Veteran Services. Public Health, Kirsten.
Good morning. So we, as you can imagine, are still just working diligently on our COVID response. In Ozaukee County, we currently have 214 cases as of last night, 15 deaths and 22 outbreaks. We have 5 currently ongoing outbreaks at the moment. We dropped the, and I think I mentioned this at the county board meeting, but we dropped the long-term care facility orders and converted them to guidance. It's on our website. It's still, we are encouraging, much like Lasada, that facilities maintain their own policies to protect their population. And I think the vast majority of them are doing a fantastic job in Ozaukee County. You may have heard that the Ozaukee County Fair plans to move forward. We are working closely with them to mitigate the risk of having a large mass gathering event. Just so everyone is clear, I did not recommend that they have a fair. The Fair Board is an independent organization and they voted to move forward. And like I said, I did not recommend it. DPI, the Department of Public Instruction, came out yesterday with an 88-page recommendation toolkit for schools. We're meeting later this morning with all of our school districts to go through it. It'll be interesting to see what they decide to do, but as of right now, I don't have any, I don't know where they sit or how they're feeling about the guidance. We have a pandemic plan that we've been working on updating. I had planned to share it with this group this morning, but I just got a final draft and I'm reading through it. It's 20 pages, but it's done. I don't know what your preference is, that we bring this back to Human Services or Health and Human Services to review first, or if we take it to the county board first, whatever your preference is, but it will be done by the end of the day. I just need a chance to review it. And then finally, we have partnered with the Medical College of Wisconsin to get a weekly data report that has significantly more information in it than what we've been able to gather on our own. So they have a team of epidemiologists at MCW who are pulling data for all the counties surrounding Milwaukee and putting it together in a really nice format that's easy to read with graphs I've seen drafts. I was hoping to have one again by today, but I haven't seen the final draft from last week's data. I saw it on Friday in a draft form. But again, that's something we can share with this group specifically or with the board. My intention with that data is to make it public and put it online, but I think it will be helpful for people to see where we stand. So,
Yeah.
And in terms of where we are with the pandemic, we saw a spike after Memorial Day, and we've been just really flat. Still sort of a steady trickle of cases every day, around 10 to 12 between the two counties.
Well, that's good news. Good news. Jason, when is our next full board meeting going to be? Is it right before the 4th, or is it
The first.
July 1st.
July 1st? So next week.
Correct.
Is that right, this week? That's July 1st already? Jeez. Probably makes sense, Kirsten, to bring it before the full board, because I know everybody is going to want that information if you have the pandemic plan. I'd like to see it beforehand, or if you could send it out to this committee before the board meeting, just so we have a look at it, and if we have any thoughts or comments we want to make before it goes before the whole board, that would be great.
Great. Kathy, I'll send it to you if you don't mind forwarding to everyone.
Sure.
I'll send it to you this afternoon.
Okay, that sounds good.
Kirsten, I don't know that it's up to you or not, but thinking about the Ozaukee Fair, I mean, is there anything as a county that we should do to try to protect those participants, you know, with signage recommending everyone wear masks and, you know, keep their distance from the vendors, from other people in line? I don't know if that's something acceptable to the board, if we have any control over that, but if that's something we should look at.
So I've met with them since they made this decision last Monday, probably 8 times already. So we are working with them on signage, on engineering structures to separate people, like flow of people in and out of barns, you know, PPE for vendors, sanitation and disinfectant. We've actually gone down to even what product they should be using to clean. So we've been working very closely with them. Again, we can't dictate anything, but they've been very, given the circumstances, they're very amenable to guidance. They've been really thoughtful. I spent an hour on Friday just with the live auction group talking about, you know, can it be virtual? How do we assure that people aren't, you know, even down to like when you take the picture with the fairest of the fair with the winning steer, how do you separate people? So they are really thinking about all of those things.
Great, that's great. Thank you.
Yeah, I've gotten very mixed reviews on the whole idea of the fair. Some people are really excited about it. There are others that are just appalled that it's happening. And I've tried to let people know that, you know, it's not, our health officer suggested it not happen, but it's kind of out of her hands. So Kirsten, thank you for what you are doing to try to make it as safe as possible. Is there any thoughts? Are they thinking that if something like the cases start to go up, is there a possibility they would still cancel, or are they just going to do it?
No, I think actually that was one of the deciding factors, which is very different from Washington County. So Ozaukee County doesn't have to pay out any large acts or vendors early on, unlike Washington County that brings in huge like national musicians. So Washington County was not able to cancel at the last minute, and Ozaukee County does have that capability. So let's say a week before, we've seen a significant increase. They've assured me that they would reevaluate and even cancel if they need to. So. Okay,
well, that's good to know. Thanks.
We work very closely with the Fair Board over the last, 6 weeks or so, as they've talked about what they intend to do and what they might be able to do and what they shouldn't do. So, we work with them. We work with public health. We obviously engage public safety, and because there are other, other concerns. In addition to the pandemic, I think specifically if we're the only fair in town, although I understand Racine County Fair is also going on that weekend. So, so yeah, they're good to work with. I think for the people on the call, and I know you know this, Kathy, but this is a volunteer board. They have no financial incentive to do this other than, they're just passionate about putting on a county fair. So I think, for what that's worth, that's one of their motivations. So I think that certainly helps in terms of their commitment to do things safely and properly. I also want to talk in terms of the plan. We just touched on this briefly. Are you asking that the board approve this plan? Because if that's the case, we really should run it through committee. You just like to get it in front of the board as information? Is that, I don't know what. I don't know where you're
purely
headed.
information. We are definitely not asking for approval.
No.
Yeah.
No, this would certainly just be, as Kirsten and I talked about, it would just be informational.
So you'd
some
like
people-
a presentation on the 1st? That is the Clay Bluffs
Oh,
debate and vote at that meeting.
that's going to be a long meeting then,
Correct.
probably. Well, if we want to put it up, I'm fine. I just thought that maybe people wanted to know. But we could wait and bring it before this committee again and then do it at the next board meeting.
Yeah, maybe let's get the final document and then we can make some decisions.
Yeah, okay. Kirsten will get it to us this afternoon. We can take a look at it and then we'll see.
All right, thank you.
Okay, anything else, Kirsten? Or any other questions for Kirsten?
Yeah, can you hear me? This is Nitish.
Yeah, Nitish.
So we've talked about the Ozaukee County Fair, but what about the community events that are going on in each of the communities? Like we have the Fun Before the 4th in Beansville, and we have the, the 4th of July parade in Cedarburg, things like that. So are we involved in those also?
There is no parade in Cedarburg.
Oh, okay.
They are doing something, Kathy. It's not being hosted by the chamber, but there are other organizations going forward independent.
With a parade?
Don't ask.
Oh, God.
Yep. So we are privy in terms of, the only way we know is if somebody reaches out and tells us. Some organizations have been much more forthcoming than others. For example, Country in the Berg is going to go forward. They've called, we've been working closely with them, but others have basically said, we don't want your input. We're going to do it. You have no authority. That's it. So it really varies. Our preference is to be a resource to communities and organizations, but it's really up to them in terms of what they, how they want to handle it.
Kathleen, I'd like to say something.
Yes, please, Lou.
Lou Hero. Jason knows my feelings on this fair because I did send him and Lee an email about it. And the only difference between Thiensville and Grafton and Cedarburg and all that, it's called the Ozaukee County Fair. So everybody that looks at it is going to say, Ozaukee County is saying this is okay. And my concerns, and Jason answered them, I still don't agree with putting it on. My concerns are, I don't know how you're going to control the amount of people. I don't know how you're going to have enough police and fire protection there. I don't know how you're going to keep people 6 feet apart. I don't know how you're going to have people wear masks. And at the end of the day, if something goes bad, it's going to come back Ozaukee County Fair. So that's all my opinion. And I also said, if the fair people are going to make money on the deal, which I hope they do, it might be less expensive for Ozaukee County to write out a check to them rather than pay for the fire department, the police department, the sanitation, and everything else. That's just my opinion.
Yeah. Well, I have some of the same concerns that you do, because as I hear people talking about it, we could be overrun with people because there's nothing else going on. And that does concern me. And I do feel for the EMTs and the police and the sheriff's deputies that have to be there. They really can't, I don't know how they would police this and try to contain it. I just don't.
And one more thing, in all fairness to Jason, he did answer. He responded back to my email, and he and I have always gotten along, but I don't agree with some of the things, mainly because of the liability issues. And the real thing is, you know, you're going to have people parking all over the place. And if there's nothing going on, we're going to have big crowds. So are we going to stand there and say, okay, you 4 people can go in now? Okay, but now I got 5 people and only 4 can go in. I just think it's going to be a major problem, and we're going to have a lot of problems. But if they want to go ahead with it, like Jason told me, there's nothing we can do to stop them.
So we had some pretty lengthy discussions because I think the public safety concerns maybe outweigh the concerns of the pandemic in some respects. And they've got plans to increase their security. They do use a paid security force. They're going to work with the Sheriff's Department, Cedarburg Police Department to go through those security plans. But yeah, I think we certainly raised all of those concerns. We talked with them about, potentially limiting beer sales, and they're going to stop beer sales early and attempt to kind of get people off the grounds a little earlier. I think the sheriff will tell you that most of the problems that happen at the county fair happen after dark. So they've taken that into consideration. So we've raised all those issues with them from the police and fire and EMT perspective, and they're working through their planning process to address those. And the county we have no additional liability because it's the county fair. That's something that we've worked through with our insurers. We enjoy recreational immunity as a municipal government, and I think as I explained to Supervisor Hero, although the E. coli issue that we had out there in 2001 was very unfortunate, we didn't have much liability even when that occurred. So I think we're covered from a liability perspective, and we're working with the Fair Board to address the public safety concerns of being because I think that was the primary concern. If we're the only thing going on in southeastern Wisconsin, will we draw more people than usual? So they're working through the logistics there, and they've made some accommodations to address those public safety concerns.
Okay. Well,
it makes me think of, the Spanish flu in 1918, and it was really the Thanksgiving Day parade that caused the whole pandemic then to explode. So hopefully that's not the case here.
okay. Well, thank you, Kirsten.
Thank you.
Human Services, Liza.
Hello. Did you want to start with the action item, the Marsh County Health Alliance
Sure.
appointment? The annual meeting was yesterday. I did attend. So I have our rate for 2021 that I've already passed on to fiscal for budgeting purposes,
Okay.
but we need someone from this, from the board to volunteer to participate in, it's like 3 meetings a year.
I will do it. I know it hasn't, you and I were on a phone call with them a while ago, and then they had directors leave and all that kind of stuff, but I tried to call in yesterday, but I couldn't get in. So I know they said there's only limited number of phone people that can get in. I couldn't get in. But anyway, and at one point, I know you and I, Liza had talked about going to one of the meetings, and hopefully we can maybe do that at some point.
They did meet in person, but and I think we were only allowed like 12 callers, so it was pretty limited.
Right.
What meeting are we talking about? What is?
It's the Marsh County or Marsh Country Health Alliance. So we have people that have higher needs, and this is a facility that like counties have kind of teamed together and they provide like a higher level of care for someone that needs to be in a facility.
I see.
How many people do we have there at this
Two.
point? Two.
Two.
Okay.
Okay, thank you.
Are you talking about people with like high medical needs, like maybe, people who are quadriplegic, or is that the type of person that would go
It could
there?
be anything. It could be fragile, just medically frail, and they're not able to go into maybe a traditional, nursing home because of their behaviors on top of that. So it's really, they take quite a diverse, group of individuals. So it's been very helpful for the county to be able to send someone there.
Right, because there have been cases even at the nursing home where we had people that just could not stay there, more behavioral kinds of issues that we couldn't handle. And we didn't have anywhere else to go. Now, when this group organized, we at least have a safe place for those people to go.
And where's the location?
Dodge County.
Okay.
And that truthfully, most of the calls we do as calls because it takes us longer to get there than the length of the meeting.
I bet.
So we didn't think it was a really good use of our time. So
thank you for agreeing to be
I will
my partner with that again.
I will do it.
I think we need a motion.
I think we need a motion, yeah. Unless somebody else really wants to.
So moved.
Thanks, Alice.
Maybe you can convince them to go virtual.
Yeah, that would be good. Okay, so we have a motion. We need a second.
Aye.
Don, second. Okay, all in favor?
Aye.
Aye.
Okay. Great. I will do it. I'll be at the next one.
Oh, bye, Kathy.
Yes.
Kathy, this is Dan Becker.
Yes,
I just
Dan.
wanted to chime in and say, you said you were doing a lot of these meetings telephonically because of the drive. Well, since I'm on that drive right now to work, I know what you're talking about. It's a long drive.
It is. We're thinking, well, I don't want to take up half of Liza's day traveling to a meeting that lasts basically half hour, 45 minutes at most. So.
Good point.
And then I wanted to just update this group. I know last time we met, we talked about some changes that had happened within our meal program. Last week, we did start a grab and go meal for people that attended meal sites, which has been very popular. And we've already had over 100 people participate starting this last week. So it was our way to reach out to people instead of congregating at a meal site, but they can pick up a meal and then leave and take it home. So that's been very successful. And then we are in the process of reintroducing some hot meals for people, which is also really nice that we're able to start looking at least introducing a hot meal, because we had, I don't know if you remember, but we had gone down to cold meal and frozen meals during this process, and we limited instead of daily contact or multiple times a week, perhaps it was just you got your weekly meals and then had to heat them. So this is nice for people to at least get a hot meal. And then financials, I wanted to let you know that we are currently in the process of determining if we should apply for the COVID-19 Provider Relief Fund. Right now, our reimbursements for behavioral health services from a telephonic or video perspective have been equal to what we were getting face-to-face, with the exception of our prescribers. So we're in the process of figuring out what our reimbursements are or have been since the pandemic started with the prescribers compared to what we would have gotten face to face. And then that difference we can apply for. So what we're waiting for now is to find out and actually get those reimbursements. So we're hopefully when this is due the middle of July, we'll be able to compile that information and apply. It's a pretty seamless process, but.
That sounds like it would be helpful to have.
Yes.
How many, are some of your staff still working from home then?
Mm-hmm. Yeah, we did work agreements with everyone. We did, once the administration building unlocked, we did introduce some staff back into the building on a rotation. So we have available walk-in in case someone comes in as a walk-in. So we have someone from the ADRC available in case someone comes in as a walk-in. We have a member of the crisis team on site. So the difference is instead of everyone being there, it's just one person a day. And then a member of the senior management team to be available 1 day a week in case that comes up. They need a supervisor there or someone that can help assist at their level. But everyone else is still working remotely that can.
Great. Anything else for Liza? Okay. Thanks, Liza. Keep up the good work. All right. It looks like we can talk. Our next meeting will be Tuesday, July 28th at 9 o'clock. Anybody want to make the motion to adjourn?
So moved.
So moved. Second, Dan Becker.
All right. Sounds good. All in favor?
Aye.
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 All right. Have a good day.
Thank
Thank
you.
you.
Have a great day, everyone.
Thank you.
Take care.
Bye-bye.
Bye now.